I know now the network is bad. So we can have it. Let's am I fine? Not working. Going to
Let's just open your send the link to
and since I started launching. It's not working on the system, but wait, I'll come and see. It's not working. I don't think the speaker of the system is working.
share your presentation.
Yes.
Why don't you use it?
I don't think she will come in this system.
Welcome to another webinar session from Post-Service Department, Office of the Head of Service. My name is Bisi Roland, and I'm your host for today. We have a health talk for us today. Epilepsy and seizure, what you need to know. And I'd like to call on our director for service department, Mrs. Durodola, to kindly declare the webinar session open. What's happening?
Good morning, distinguished participants. I would like to specially recognize members of the Association of Retired Heads of Service and Permanent Secretaries who are already on this call. It's a pleasure to have you this morning. Like our host mentioned, we are going to be talking about epilepsy and seizure disorder, what you need to know. There is the general belief that this medical condition is only common among the younger ones, children. But researches have shown that this medical condition, the risk of it even increases with age above 60, specifically. On that note, this morning, we are going to be looking at how to recognize this condition, how to manage, and how to support people living with this condition with a view to reduce stigmatization. On that note, it is my pleasure to declare this webinar session open. Thank you very much and good morning.
Thank you, ma'am.
Over to you, Mrs. Roland.
Yes, ma'am. Thank you. Our facilitator for today is Dr. Farotimi Josephine, and she's a passionate physician with a keen interest in providing excellent medical care to patients. She presently works as a medical officer in the Lagos State Ministry of Health. She has so much passion for maternal and child health, with the well-being of her patients being her utmost priority. She enjoys traveling and meeting new people. She graduated with a she graduated with Bachelor of Medicine and Surgery from the Lagos State University of Medicine, LASUCOM. She's a diverse healthcare professional who enjoys working to make sure her patients get the best healthcare treatment possible. Good morning, Dr. Farotimi.
Good morning, Ma. Good morning, everyone.
Yes, good morning. Welcome. Good morning.
Thank you,
The floor
Ma.
is yours, please. You can go ahead.
Okay. Good morning, sirs and Ma. Standing on existing protocols, I would like to talk on epilepsy and seizures, what we should know. Okay, Ma, please, can we convert it into a slide share format? Thank you, Ma.
Is this okay?
Yes, that's fine, Ma. Thank you. So what we're going to know after this presentation is that we're going to widen our knowledge on seizures, also know more about epilepsy. How do you support people who have seizures and epilepsies, and basic first aid procedures for people that have seizures? So next slide, please. So what is a seizure? A seizure occurs when there is an imbalance in the electrical activity of the brain. So usually how our brain functions is that we have some electrolytes in our blood and all of that. That's where you have sodium, you have potassium and all. But when there is an imbalance in the normal electrical activity of the brain, it can result in a seizure. And how does a seizure manifest? That's when you observe that someone is having uncontrollable movements of the body. You observe that the person's speech can get slurred, or oftentimes they start having saliva drooling from their mouth. You can also notice that the person has issues with the eyes, where there's maybe upward rolling of the eye, abnormal eye movements, or even that the eyes are closed. Also, on some rare occasions, people are not aware. People with seizures, when they have that episode, they are not aware of their surroundings, or maybe they are not even aware of that behavior. So it's possible to have a seizure and not have convulsion. That is, someone can have a seizure without the usual jerky body movements that we all are used to seeing. And oftentimes, people have seizures and they convulse. And the frequency at which these things happen differ from person to person. Next slide, please. So, what are the signs of a seizure? For some people, even before the seizure starts, that is, even before you start seeing the physical manifestation of the imbalance going on in their brain, they have something we call aura. What is an aura? Aura is the preceding sign or the preceding symptom of a seizure, where some people, they start smacking their lips, or they start staring blankly into the air. At times you're talking to someone and the person just, in the middle of a sentence, the person goes blank. So that is an aura. Or for some people, they start sweating profusely, or they are shaking, they are restless. They know, okay, a seizure is about to happen. For some people, they have those preceding signs before the actual onset of a seizure. So what are the signs that one is having a seizure? Extended blank stare. This is common in children, where their eyes are opened, they are looking, but they're actually not even seeing anyone. They can't communicate with anyone. They are just there. So it is commoner in children, it is less commoner in adults. Empty look in the eyes is also related to the extended blank stare. Rapid blinking of the eyes, or the eyes rolling upward, which I know we all would have seen either in movies or even in real life, where someone just falls on the floor and you can only see that white part of the eye, the dark part has rolled upward. Periods of unresponsiveness. You just come, you meet someone, you call the person's name, the person is not responding, you try to touch, person doesn't even sense that anyone is touching them, they're not aware of their environment. That's the sign of a seizure. Inability to pay attention. This is commoner in children, usually between the ages of 6 months to 6 years. They are in class, their teacher complains that, oh, the child just suddenly, that's where the word daydream came from. The child just suddenly lost was not paying attention in class, and it was transient. And most times, this particular type or this particular sign unnoticed, because it can just span for a few seconds, after which the person is back. Also, another sign is repetitive tic-tac movement of the body part, usually the head, arms, and legs. That's the common signs of seizures that most people are familiar with, where the person is jerking the body, jerking the hands, jerking the leg, and moving about. Uncontrollable body jerking movement, mouth movements with a dazed look. That's the lip smacking I spoke about. Frothing at the mouth, that's where saliva comes out of the mouth and all. Loss of consciousness, the person is totally unaware of their surrounding. Loss of body control, dazed walking, and at times after the seizure, they get confused. They don't even understand what happened. They are not aware they had a seizure. They were not aware of what happened before the seizure. Next slide, please. Thank you, Ma. So, how do you distinguish a seizure from epilepsy? Now, when you see someone with those physical signs I have demonstrated, and that is the first time it is happening, or it occurred due to high temperature, high body temperature, which is fever, or temporary medical conditions like low blood sugar. Commonly, for elderly people, they've not eaten all day, their sugar level is low, they are walking on the road, suddenly they fall, they're having a seizure. Low blood sugar is a common cause of seizures in old people. Or maybe they had a stroke, which is an insult to the brain, or they had a fall, they fell, they hit their head, and there was trauma to the head, or they even have infections of the head, like cerebral malaria, which is like a complication of malaria, meningitis. Those are things that can cause seizure. So when you see someone that is having those symptoms for the first time, or the seizure is due to a particular disease, the symptoms is due to a particular disease, that is a seizure. And oftentimes, after you treat the cause, that is, after you treat the origin of those clinical symptoms you're having, the seizure stops. That is, the clinical sign stops. That is a seizure. Or what is an epilepsy? Epilepsy basically means repeated, frequent seizure episodes, which most times do not have a known cause. I'll take that again. Epilepsy means frequent or recurrent seizure episodes, which most times do not have a known cause, and this can occur at any age. Please, next slide. Thank you, Ma. So, like I explained earlier, epilepsy makes people susceptible to seizures, can occur at any age, and can occur without a known cause. Next slide, please. So why do seizures occur? I've said this previously. First and foremost, head injury. Someone was probably participating in a sport or was involved in an accident or took alcohol and had a fall, or took excessive alcohol, which on its own can trigger a seizure. That can be a cause. Also, whenever there are tumors in the head, that is, there are some tumors like a cancer, whether a cancerous or a non-cancerous tumors, excuse me, please, or even a stroke, that can also cause a seizure. Also, for some people, it is hereditary. That is, it can run in the genes. Less commonly, that can be a seizure. Fever can cause a seizure, and this is usually common in children, where you notice that their temperature is high and they suddenly have a seizure, especially during the age of 6 months to 6 years. Also, during delivery of children, for women that labor for a very long period of time, or for children that when they are born, their bilirubin level, that thing that is in the blood that causes their skin to turn yellow, when it is very high in their blood, it can make them have a seizure. Also, some congenital disorders, infections like meningitis, measles, mumps, and diphtheria can cause a seizure. But for these infections, they are very preventable now because there are vaccines that would be given to children at delivery that would prevent them from coming down with these infections that can trigger a seizure. Please, next slide. So what can trigger a seizure? This is just to re-explain what we have discussed earlier. Stress, less commonly, can cause it. For some people, excessive excitement or even stimulation in the sense of using stimulants like all those art drugs, cocaine, cannabis, and all of those things can trigger a seizure. I'm sure some of us, or even all of us, would have seen some people where they've abused drugs and then they are drooling saliva, they're having jerky movements of their body. That's stimulation. Excessive fluid, I mean oral fluid intake during medical treatment. If some fluids are excessive, it can trigger a seizure. Extremely low blood sugar in diabetic patients, especially in elderly people, when they have not eaten all day and they're hypoglycemic, they are prone to having a seizure. Excessive sunlight. Some people, when the weather is too hot, they can have something we call a heat stroke, and that can cause a seizure. Excessive heat, humidity. For some people, exposure to flickering light can trigger seizures in some people, in very few people. Light can trigger seizures in very few people. Skipping meals, that is related to being hypoglycemic in elderly people. Illnesses, fever, allergic reaction, that is very bad allergic reactions that can warrant hospital admission or even intensive care admission can cause a seizure. Lack of sleep, when the brain is not well rested and the brain is when there is an insult to the brain, it can cause a seizure. Excessive alcohol intake would cause a seizure. For patients that are known to have seizure disorders or even epilepsy, and they are not compliant with their medications, they are prone to having recurrent seizures. Also, for patients who have abused drugs like cocaine, cannabis, or anyone with illicit drug use, during the period of them trying to withdraw from the addiction to those drugs, they can come down with a seizure, and that is what we call withdrawal symptoms. So these are a few things that can trigger a seizure. Next slide, please. So briefly, let's talk about the types of seizures. This is quite medical, but I just want to give us a little understanding. So seizures can, like I said, it is due to an electrical imbalance in the brain. There are parts of the brain. We have the front of the brain, the back, and the sides. So when there is an insult to the brain, where it is just a part of the brain that is affected, we call it a focal seizure. As the name implies, focal, it is due to just one particular part of the brain. But when the insult involves every part of the brain, that is the entire brain itself, we classify it as a generalized seizure. And for those seizures, you can also distinguish them based on their characteristics. You can have the simple partial and the complex partial seizure. That is more for people that are in the medical line, so let me not bore you with that. But for the generalized, you can have the tonic, the atonic, tonic-clonic, myoclonic, and absence. I will start from absence because it's commoner in children, so I would like to progress from children to adults. So for these absence seizures, like when I started earlier, I mentioned that a child can suddenly start staring blankly into the space, which can go unnoticed and last for very few seconds. That is absence seizures, as the name implies. Absence. The child is absent. The child is not aware of the environment. They do not have the classical jerky body movements. It's not. It doesn't come with all those symptoms that we mentioned. It's just transient and will disappear. And oftentimes it can go unnoticed. But how you can know is that maybe there is a child and the child just explains that, oh, they notice that this child just suddenly stares blankly into the space, or this child was having a conversation and just in the process of making a sentence, the child just paused for like 5-10 seconds. And by the time the child came back, the child can't even remember what the child was talking about. Your attention should be drawn towards absence seizure. For myoclonic seizures, it affects commonly the head and neck. That's usually the jerky body movements, but commonly affects the head and neck. Tonic-clonic, that's when the entire body is jerking. That's the common type we see out there. Then tonic seizures affect the hands and the legs. Please, next slide. Next slide, please. Thank you. So, treatment of seizures. How can we manage patients that have seizures? Before I start this, I did not add this particular slide to part to my slide. I will first want to talk about, okay, let me do the treatment first. First and foremost, the treatment is that they have to be on medications. And usually these medications are usually lifelong medications. That's for patients that are having recurrent seizures, which is classified as epilepsy. And this medication is not to cure this particular ailment. It is just to make it controlled, whereby the patient is able to have a balanced life and move on with their day-to-day activities without having frequent seizure attacks. But for patients that have seizures due to underlying illnesses, probably fever, maybe a tumor in the head, maybe a stroke, or maybe from not eating, things as basic as giving food after recovery, taking the patient to the hospital to treat the fever and all of that would stop the seizure. So the goal is to also treat the patient with the least amount of drugs. As we all know, every drug is a potential poison. So whatever medication we are giving the patient, we would always encourage patients to be compliant, to be strictly compliant with their medications, so that we do not have to always add up medications where you have to start taking large quantity of drugs and increase the side effects you would have. For some people, surgeries, like I said, for people that have brain tumors and the rest. For some people, special diets, like for patients that have low blood sugar, we want to give them food that is high in calories to reduce their chances of coming down with seizures. Please, next slide. So just a brief one. How does epilepsy affect people that are working? That is, how does it prevent them, or how does it impact their daily activities? The truth is, this would lead me to the myth. I'm here today to debunk some of the myths we've had as regards seizure disorder and epilepsy. So the truth is, when epilepsy is managed effectively, strict compliance to medications, support from family members and loved ones, the person will actually have a very normal life. The person is encouraged to participate in any activities the person would like to do. But for some kids in school, they might need some extra support. For some children, their teachers would have to be in the know that the child has this particular condition, so that close attention can be paid whenever this child has such symptom. Some people may be more sleepy than usual, which can occur either after the seizure episode or even after taking their medications. And most times, this is temporary. So that is to say that people that have epilepsy can have a very balanced life. And yes, they can have a very balanced life. Please, next slide. So first aid management for people that have seizures. The first thing you should do is to please do not panic. Stay calm. Be as calm as possible. That is not the time for people to gather and to surround the individual, because like I said, excessive heat can pose one to be at risk of having seizures. So for someone whose seizure was due to excessive heat, now imagine a very large gathering surrounding the person. You're worsening the symptom. That is, you're even making the trigger to be more present, and which would eventually worsen the seizure or increase the duration of the seizure. And for seizures, most times, we always want either the person to be seizure-free, or at least the duration of seizures should not be too long. Because for every time there is a seizure, it is more like there is an insult to the brain, which can always cause further damage to the brain. So please, whenever you see someone having a seizure, stay calm, and the crowd around that scene should be as minimum as possible. 2, note the time of the seizure. Take your phone or your watch, pay attention to when the person started seizing and when the person stopped seizing. We want to know how long the duration spanned for. Most seizures most times last less than 5 minutes. So this is going to also help the doctor when they get to the hospital, because we'll ask you questions. Oh, when this patient was having the seizure, did it involve all parts of the body? Please, how long did the seizure take? Or did this patient have saliva coming from the mouth? Did this patient do this? Was this patient moving all part of the body? Did this patient vomit after the seizure? Did this patient lose consciousness after the seizure? Oh, did this patient urinate on their body, or did this patient poo on their body after the seizure? Because for some people, after seizures, they have what we call incontinence, where they cannot control the urine or poo coming out of their body. They just poo on their body. So I want to know all of that. So that is the time for you to what? Pay attention to those signs or the symptoms that the patient is having. Also, for longer seizures that last more than 5 minutes and the patient is unconscious, such patients want to go into the ICU and not just the ward. So the relatives of someone that is around such patients will actually help the doctor offer the best level of care to the patient by taking note of the time of the seizure. The third thing to do is to protect the person from harm. Please, if there are chairs, if there are tables, anything around, if there are objects, please move those objects away from the person. Please, for everyone having a seizure, allow the seizure to run its course. Do not try to restrain the person from having jerky body movements, or trying to put your hands in the person's mouth or put a spoon in the person's mouth. Please, by doing that, you are causing more harm to the patient. Do not pour water on the patient's body. Do not use clothes to tie the legs and hands of the patient, or put fire on the patient's hand. By doing that, you are causing more harm to the patient. Now, why do we tell you not to do all of this? Because a seizure will always run its course. All those things you try to do would not in any way help the patient. By trying to put a spoon in the patient's mouth, the pressure at which the teeth is clenching together, a tooth can fall off. And for someone that is not aware of how their body is jerking, at that moment, they are not aware of their environment, they're not aware of what their body is doing. The body movement is not under their control. If a teeth falls off and it enters the person's throat, the person's mode of swallowing, that is the reflexes that are responsible for normal swallowing, are not functional at that moment. That is, whatever swallowed can go into the lungs and not into the stomach. And in summary, you have successfully caused more harm to the patient. We don't want all of that happening. Do not put any form of leaf, be it bitter leaf, saint leaf. Do not put anything in the patient's mouth. Just move the objects away and allow the person have the seizure. Next slide, please. Now, next thing to do is put the person in recovery position. What is recovery position? First and foremost, place something soft under their head. If it's at home, you're able to get a pillow, that's fine. If you're not at home, if you're at work, even if it is someone's handbag, you can pour out the object in the handbag. It will become so soft. Place it under the person's head so that in the process of jerking, the person is not hitting their head on the floor multiple times and also sustaining injury to their head, because we've also said that injury to the head can also cause seizure. We do not want to worsen the patient's symptoms. After doing that, please roll the person to their side, preferably the left side. So you roll the person to rest on the left side of their body. We call it a left lateral position. It is always safe to do that because while the patient is in the left side, risk of aspiration is very slim while the patient is on the left side. After doing that, if the patient is on any form of clothing, maybe a necktie or a tight shirt or something, please gently take off the tie. Or oftentimes, if you're trying to take it off, or if you're unable to take it off, for example, if it is a woman or a lady and you have to take off the zip and all, the patient is obviously convulsing and will not be able to cooperate. You can just use a scissors to tear the uppermost clothing so that the patient has adequate exposure to air. Remember, we said excess heat can cause seizure. Are we together, please? And then the next thing you want to do is, like I said earlier, take note of the part of the body that is jerking. Oh, is it the left side of the body that was moving, the left hand and the left leg? Or was it every part of the body? Or was it just the head and neck? Then you also want to note how long the seizure lasted. Also, how the person acted before and after the seizure. Like I explained earlier, for some people, they have something we call aura. Aura are the signs and the symptoms someone has before coming down with a seizure. Maybe they were smacking their lips, they were sweating profusely, they were restless, or were just acting strange, which is different from their usual behavior. Once you observe that, please note it. And also after the seizure, did the person wake up and ask, please, what happened to me? Why am I on the floor? Or did the person even become unresponsive, that his eyes are closed, the person is breathing, but the person can't even respond to any form of stimuli? If you try to talk to the person doesn't sense it. If you call the name, the person doesn't respond. Please take note of that. Or did you observe that the person's clothes is soiled with urine or feces after the seizure? Please take note of that, because it also helps the doctor offer the best level of care to the patient. Please, next slide. Next slide, please. Okay, thank you, Ma. So for a patient that has recovered and feels better, for a patient that can talk after the seizure, please talk to them gently, comfort them, and reassure the person. That's not the time to start asking, do you have seizures? That's not the time to run away from such a person. Please note, epilepsy or seizure disorders are not contagious. There is no relationship. There is no way epilepsy or seizure can be transferred to someone else by contact. So you do not have to run away from them. Please help them. If you've undressed them, try to provide clothing for them. If they are tearing, comfort them. Stay with them until they are very much aware of their environment. Check their bodies for any form of injuries, for cuts, for places where they are bleeding, or for swelling. For example, someone hitting the head repeatedly on the floor, the forehead or the back of the head might be swollen. Please check for that. Also, you can pick the person's phone and call the closest relative so that they can be of help. Because for most people that either have seizure disorders or epilepsy, their family members are always in the know. So you can call them to, please come to this social person at social location, or please come meet us at this particular hospital as your relative has been taken here. Please allow the person to change clothing if necessary, like I explained earlier. If they feel sleepy after a seizure, please, that does not mean the person is going to die. For some people that have seizures, they want to sleep, they are tired and might want to sleep. Please let them be after the seizures. Do not try to interrupt the sleep, just leave them to be. Then they may complain of headache or be confused. For some people, even after the seizure, they're not aware of what's going on. They start asking, what happened? Were they the ones that did this? Were they the one that did that? Did people see them do this? Please just try to provide succor to them as much as possible. Please do not give food or water to the person until the person is fully awake and alert. Like I explained, for someone that is having a seizure, the reflexes, that is the part of the body that is in control of how we swallow, is not functional at that moment. So there is a chance that anything forced down their throats would go into the lungs and not the mouth, which would cause another thing entirely, which is in turn causing harm. So please ensure the person is well oriented and aware of their environment before you give food. Then, even after the person is fine and has recovered, pending when the person will be taken to the nearest hospital or will be taken home, or before pending when a relative will come, at least one person should remain with the person till help comes. Please, next slide. So we have emergency care lines in Lagos State, where we have the Lasambos ambulance services that can be of help. Peradventure, you see someone having a seizure or having convulsion. Seizure is also the same thing as convulsion. Person is having a convulsion, you're not able to access the person's phone, you're unable to access the person's family member. So you really can't tell if this is the first time the person is convulsing or this is not the first time, or the person has been convulsing, it's been more than 5 minutes, or the person has been convulsing, and even after convulsion, the person is not coming awake. That is, the person lost consciousness, eyes are closed, the person is not responding to any form of external stimulus. Please call the emergency line and care will come to you immediately. The call line is 112, down 112, excuse me, please, down 1112, and an ambulance with paramedics would arrive at your venue immediately. So, like I said, so for someone that has stopped breathing, so note, the person is unresponsive does not mean the person has stopped breathing. The person's eyes might be closed, the person might not be able to respond when you call, you might try to touch the person and the person doesn't even sense it. That means the person is unconscious. That does not mean the person is not breathing. So what you can do is that just observe the person's tummy to see if the tummy moves up and down as the person is breathing. If you see that, it shows, okay, this person is breathing and this person is stable. But if you look for at least, at most, 30 seconds and there is no movement of the abdomen, please start something we call CPR and inform 112. That information is very vital. So when we call 112 for someone that is not breathing, please let them know that this person you're coming for is not breathing, is not breathing. So we're able to understand that that is very urgent and they will be with you as soon as possible. Please, you start something called CPR. Full meaning is cardiopulmonary resuscitation. CPR is a basic life skill that anyone should have. After this meeting, you can go on YouTube to watch some short videos on CPR. But CPR just basically means that cleansing where your hand is on the chest, in between the two breasts, whether for a male or female. You put your hands at the middle, in between the two breasts. You lock your fists together. Can we see me, please? Hello? Can anyone hear me?
Yes, yes,
We can hear
see
you.
you and we
We
can
can
hear
hear
you.
you.
Okay, can you see me, please?
Yes.
Yes, we can
Okay,
see you.
let's
Please
go
go
back to
ahead.
Okay. Okay, please go back to the previous slide, Ma. Thank you, Ma. Thank you. So your fists are locked together like this, and you're applying pressure in between the person's chest with the lower part of your hand.
Hello.
You do
You're
30
not
times.
visible again.
I'm not visible again. What about now?
Please go ahead. We can see you. Please go ahead.
Sorry, we can see the slide, but we are not seeing you. Please. Thank you.
Oh, okay. I think it's her network. Yeah.
I'm seeing you now.
Hello, doctor.
If the person stop breathing for 30 minutes, you must stop for help.
Okay. 30 minutes. 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 30 minutes Hello, doctor. Your video is gone, but I can see that you're still on the call. Okay, while she comes back online, okay, she just sent a message now that she's trying to reconnect. Yes, I think it's her network. Yeah, so once again, the topic is epilepsy and seizure, what we need to know. And so far, she has explained what epilepsy and seizure are, and she gave us the difference. She said that epilepsy is a medical condition that affects the brain, and it causes a person to have repeated seizures, not just one. And the difference in seizure is that the seizure happens when there is a sudden or a brief change in the brain's activity. And she also said that during the seizure, the person may lose consciousness, shake uncontrollably, and stare blankly for a few seconds, feel confused, and have strange sensations. She also mentioned that that seizures are not the same. I think that some are mild and some are some go for a long period. Okay, she's not back. Then she mentioned what we have to do when someone has a seizure. We have to stay calm, remove dangerous things from the way of the person having the seizure so that they won't get hurt. She also mentioned that we should turn them on their side. The best side is on the left side, and this would help them to breathe properly when the convulsion stops. And we shouldn't put anything in their mouths because it would affect their swallowing, so that they don't choke. Then we should check the length of the seizure, that is the time. If it's more than 5 minutes, we should get help immediately. And the emergency number to call is 112. That's if you don't get a family member or someone that knows the history of the person. So we should call the emergency number, which is 112. And she also mentioned that we should learn CPR, which is very, very important and crucial. I think we've talked about CPR on one of our webinar sessions before. But anyway, we can check on YouTube, we can check online on how to. Hello, doctor, are you back? Let me see. Okay, no, she's not back. So we should know how to do the CPR.
Hello, can you hear me? Am I audible?
Okay, yes, I can see and hear you now.
Okay. I'm sorry, please. Apologies. My network went off.
Oh, okay, no problem. I was just giving a recap of what you've said so far. So you can go on, please.
Okay, thank you, ma. So we can watch the video on how to perform a CPR in case the patient is not breathing. Then also call 112 if the seizure lasts longer than 5 minutes. Also, if you observe that the person has, even if the person is a non-seizure disorder patient or a known patient with epilepsy, and the person has more than one seizure in 24 hours, or you notice seizure in a pregnant woman, or the patient is diabetic, please, even if the patient tells you they're a non-seizure disorder patient, such patient should be taken to the hospital. Then, if this is the first seizure the person is ever having, or you don't even have an history of the person, please take the person to the hospital or call 112. Or in the process of having a seizure, serious injuries occurred, Please, next slide. Thank you, Ma. So you notice someone seems unwell, the person cries out suddenly, or the body becomes stiff and starts to shake. What type of seizure do you think this can be? Someone is unwell, the person cries out, the body is stiff and starts to shake. This is a tonic-clonic seizure. I just decided to put a case study just for us to see how these disorders can manifest. Please, next slide. Okay, so this is another case study. Someone would volunteer to give an answer to this question. This person is likely to be experiencing a tonic-clonic seizure. That is, the person is on the floor and the person is jerking their entire body. What is your option? 1, call 112. 2, stay calm, clear the space around the person and protect them from harm. 3, restrain the person and put something in her mouth to keep her from biting down. Please, between these 3 options, what will you do first? Anyone?
Please, you can unmute yourself if you want to answer the question. Oh, okay. Someone has answered.
Thank you. So the best thing is to stay calm, clear the space, and protect the person. Thank you, Ma. Please, next slide. So, in case there is a family member or a close one or a loved one that you notice to have a seizure disorder, what are you supposed to do in case you have a call that such person has a seizure, either at the workplace, at school, or on the road, anywhere? Please provide information as regards their health history. 2, follow them to the hospital if possible, or if you're unable to, have a virtual consultation with the doctor. And 3, provide the medications of the patient to the hospital, are aware of their surroundings. So in case you have anyone or you know anyone that's having a seizure disorder, you can always take pictures of their medications, just in case that person has a seizure and the person is in a situation where they're not aware of their surroundings, they can't remember the drugs they take, so that you can help we doctors to know what to do. So we don't even give the patient an entirely different medication, because for patients that have seizures, we try to, at most times, give just one medication so that we reduce the adverse effects they can get from all these medications. You also join the doctors to make treatment decisions depending on the cause of the seizure. Medical alert identification, I'm not sure how well that is well known in our space, but if we are privileged to have one, the patients can always have that, so that in case the person is having a seizure and there is no familiar person around, anyone that is willing to help would notice that patients need help and will provide help as soon as possible. Also, communicate with the organization where the individual is working, or communicate with the school where a child is schooling as regards their health, so that they are aware and they will know the next thing to do just in case anyone has a seizure episode at any time. Please, next slide. What's your responsibility as an organization where the person is working, where the person is schooling, or your staff are home? Ensure that you are aware of any staff or any individual that has a seizure. For anyone you're taking to work with, you should know, okay, please, have you had a seizure disorder? If yes, okay, how frequent does this happen? Or when was the last time you have a seizure? Because medically, we always say, for any patient who's placed on medications for seizures, if you're able to stay 6 months, and within that 6 months you're seizure free, you can go about your usual lifestyle. You can do anything you want to do. So we always want to try to ensure that such person is seizure free for at least 6 months. So if you're trying to employ a staff or you have anyone around you and you want to ask for that history, you should ask that, oh, when last did you have a seizure? You want to take note of that date. Then two, we've been lectured on the first aid protocol for any patient that has seizure or any individual. Medical alert planning or request for medication forms have been provided, has been received by the family. This is usually when patients have been taken to the hospital and the family members want to provide a detailed history on the patient's care so far. Patient's medications should be carefully kept, even at workplace. So for anybody that has a seizure disorder, other than the patient always having a medication, whether in their bags or in their pockets or something, even at their place of work, they should always have medications there because it can come up at any time. What happens if the person didn't come to work with medications that day? Then also, every time you witness the person having seizures, please always take note of those things we mentioned earlier and also reach out to the nearest family member as soon as possible. So a quick one, this was not stated in the slide, but I just want to use this opportunity to debunk some myths that we have seizures. First one is that people believe seizures are always dramatic. I'm sure we have all learned that people can actually have seizures without their whole body jerking or moving. Someone can just stare transiently into space. Please note that that is also a type of seizures called absence seizures. Absence is also spelled as absent seizures. So we've learned that also that seizures are not always dramatic. So just in case your attention was called to someone that stared blankly into air, or they just noticed upward rolling of their eye, please do not invalidate that person's symptoms, and that can be a sign of seizures. Two, means that people that have seizures cannot be treated. Please, that is not true. For people who have seizures, there are medications that they can take. There are preventive practices that they can have. And also, there are also family support that can be provided to them to help them have a balanced life. But please note, epilepsy does not have a cure. Seizures can be cured because by treating the cause of the seizure, you have stopped the episode of the imbalance appearing in the brain. But for epilepsy, it has no cure. But with medications and also with family support, they are able to live their life as best as possible, just like any human being. So, beliefs that people that have seizures cannot live a normal life is not true. Also, three, beliefs that contact with lizards can cause seizure. Please, it is not true. Lizards do not have any relationship with seizure. Also, beliefs that seizures can be transmitted, especially for someone that is having a convulsion and the person is having this foamy saliva from the mouth. Please, it's not in any way contagious. If you can wipe the person's mouth at that point in time, please do provide as much support as possible. Nothing can be transmitted to you from convulsion. Also, beliefs that you have to always restrain someone during a seizure or you have to put a spoon in the person's mouth, please debunk all of those myths, as those things do more harm than good. Also believes that anyone that has a seizure is maybe from another world or is a goddess or something. Please, that is not true. Seizure is just a medical disorder, just as the way malaria is a disease. Also, believes that every seizure is an emergency is not true. For people that have not been having seizures, that is for patients that have epilepsy, when that is someone is convulsing and this is not the first time of the person having a seizure, but they've been having recurrent seizures, that does not necessarily have to be an emergency. I have explained earlier signs to look out for that can make you say this is emergent. If the patient is unconscious, if the patient is not aware of their surroundings after the seizure, if the patient is not breathing after the seizure, if the patient has incontinence, that is passing urine or stooling after seizure, then you can decide to call the nearest healthcare line for help. So I hope with all of this, we all have been able to understand the meaning of seizure and epilepsy, and also being able to debunk the myths that we have seizures. Thank you very much.
All right, thank you very much, Doctor,
Thank you, ma'am.
for your insightful presentation. Thank you. Yeah. Thank you everyone for still being on the call. Now we've come to the question and answer session. So please, if we have any questions or contributions, kindly raise your hand, or you can type in the chat box, or we'll call on you so that the facilitator can answer your question. Okay, in the chat box right now, people are just appreciating your presentation. Okay, Jonah Olufunke Kushimo, good morning.
Good morning. Good morning.
Please, can you unmute
madam.
yourself? Good morning.
Yes, I've done that.
Good morning,
Good morning.
sir. Please go ahead.
Good morning. Please, my name is Johanna. I'm a woman, not a man, and I'm calling from Abuja.
Oh, I'm
So
sorry. Okay.
I'm coming from Abuja. So I want to thank the doctor for the presentation
All
on
right.
seizure
Thank
and
you.
epilepsy this morning. But I have a question on this particular subject, because I have a small place for special children, and I've experienced children with cerebral palsy. Majority of them have seizures. I don't know whether I can fully say seizures of epilepsy, because I noticed that the cerebral palsy children here with me, they normally have seizures. Sometimes maybe twice in a week, sometimes maybe thrice in a week, sometimes continuously like that. It depends on individual. But one thing I noticed when about the medication, we find out that the medication use, as you said, that it's a lifetime medication, that it must be on it for lifetime. We find out that I found out that in taking care of them, managing them, we find out that these children, the medication suppressed their cognitive. But when you use the medication, it reduces the seizure, quite all right, but it affects the cognitive. So what do we do about that?
Okay, thank you, ma'am. So, first and foremost, for patients with cerebral palsy, they are most likely epileptic. That is, they have a seizure disorder. First, most of them either have these symptoms, usually from birth, either in the process of being delivered, their mother labored for too long, or when they were born, they didn't breathe for quite some time, and there was no oxygen supply to the brain. Usually, when there's no oxygen supply to the brain for a minimum of 3 to 4 minutes, there is usually a permanent brain damage. Emphasis on permanent brain damage, or that thing that causes yellowish discoloration of the skin that we call bilirubin, when the levels are usually very high at birth. Those sort of children are close to having cerebral palsy. And for a child to be said to have cerebral palsy, the brain damage is usually permanent. That is, the deed has been done. So the purpose of those medications is to make. Can you hear me, please?
Yes, we can. Please go ahead.
Okay.
I can't hear you from my end here. Please repeat that statement again, the last statement.
Okay, so I said for patients with cerebral palsy, the damage has been done. It is usually a permanent damage, that is, it cannot be reversed. So the purpose of those medications are to provide quality of life or make those symptoms as mild as possible. It cannot stop those symptoms, but it's to make them as mild as possible. And these drugs do not in any way affect their cerebral function. What affects their cerebral function is the insult they had to their brain at birth, either through the bilirubin, either through passing through birth canal that is tight, or through labor that has been long, or for a woman that she has passed a water broke a days before and she had not even fallen into labor and she's still carrying such child about, that child is going to have an infection that is going to spread to the brain. And all these things will cause a permanent brain damage. So in as much as we try to give these patients medications, we tell them to see a speech therapist, see occupational therapist, these are just to try to provide support as much as possible. And this treatment we prefer do not in any way worsen their cerebral function. The cerebral function has already been, there was a permanent damage has already been caused, which is not due to the drugs. So the reason that might seem that way is because as the child is growing, there are some milestones the child is supposed to attain, but this child is not going to or would have difficulty attaining those milestones or may even attain those milestones. Okay, for example, by age 2, we expect that children should start working. But for some patients with cerebral palsy, even at the age of 10, we still have to support them to work. These damages were not done by the drug. It's due to the insult that has occurred to the brain at some point or the other. So it's also a myth that has to be debunked. Drugs used to treat seizures do not worsen symptoms. I hope you understand, ma'am.
Okay, thank you. Thank you, madam.
Okay, I can see another question here. The person says, I would like to know if an epileptic patient can be a professional driver. So, yes, please. An epileptic patient can have a lifestyle like every other human being. But before you will be allowed to take up major taxes or major jobs or any form of job, you must have been seizure-free for at least 6 months. That is why it's important to adhere strictly to the medications and every instruction given by the doctor or the healthcare provider. You must have been seizure-free for at least 6 months. This gives a notion that one, the seizure disorder is under control or well controlled. So you're able to live your normal life. But those questions are going to be asked because the frequency of the seizure can also state the extent of the brain damage. I hope that answered your question. So
yes,
I can also see.
Thank you very much.
You're welcome, ma'am. I can also see another question. Please, what are some of the other major factors that can trigger off a seizure or epileptic attack? Yes, a loud noise or even light can trigger a seizure disorder for some people. Exposure to light, very bright light, too much excessive sounds. Also, excessive heat can trigger seizures. We've seen some people that are at times students on assembly ground or even people at the workplace, there is no light, their place is stuffy, and suddenly they fall down and start convulsing. Just the same way fever, very high body temperature can cause a seizure. Excessive heat can cause a seizure. So other than the medical or metabolic insults, there are some other lifestyle things. Even excessive alcohol intake can cause a seizure. So there are some other things, or even a fall, anything that can cause a trauma to the head, or even malaria that is so bad that has spread to involve the brain can cause a seizure. So there are diverse things that can cause a seizure disorder. I hope that answered your questions.
Okay, do we have any other question or contribution?
Sorry, let me come back and contribute something. Joanna speaking again. Please, I noticed that because of this experience, I've had this experience for about 24 years.
Okay.
In this experience, 24 years. So I noticed that because I've gone widely, sought people advice, doctors, professionals, or special needs children, or special needs educators that are professors or professors. I have sought widely to know how to solve this problem a little bit. And I believe as I'm sitting with you now, 80% of the problem has been solved. I've been solved through this, through my going around to ask one question or the other. I resulted into giving a cerebral palsy child vitamins. I introduced vitamins into the medication of the cerebral palsy child in the course of my care. So I found out that it diminishes or decreased the seizure to a minimal level. A month, sometimes there will be no seizure. Sometimes in a year, find out that the seizure maybe by the time we count, maybe 10 times in a year. So I indulge myself continuously and advising the children with cerebral palsy in my center and their parents. I involve them in indulging them to go on vitamins through my professional knowledge from professors in child needs, special needs educators. So, and it really worked. It really worked for those children. So that is my additional observation.
Thank you, ma'am.
Thank you. Okay.
So you can go ahead.
Oh, okay. And I just wanted to thank her for that contribution. I've never heard of that, but that's something new that we've learned. So what she's trying to say was that the epileptic, or is it let me even get this right. Is it for epilepsy or for just cerebral palsy patients that she's talking about?
For cerebral palsy children that has seizures continuously, so it has been reduced to minimum.
Okay.
Thank you.
All right, thank you, ma'am. Okay, there's another question in the chat box. Can someone with seizure have short of breath? That is difficulty in breathing.
Okay, so we discussed this earlier, that for people that have seizures, after the seizure or at times before the seizure, when they have something we call aura, they can experience all of those things. They have difficulty in breathing, they are sweating profusely, or they are rolling their eyes, they are smacking their lips. After the seizure also, you should, I mentioned that you should look at their abdomen to see whether it's moving with respiration. So it is very possible that there can be difficulty in breathing with a seizure episode. But after the seizure episode has been treated, if such individuals' difficulty in breathing still persists, such person should visit the hospital for examination, because there is a likelihood that the difficulty in breathing is occurring on its own, that is, it will have another cause other than it being related to the seizure. But most often times, during a seizure attack, there can be difficulty in breathing. But if there is difficulty in breathing without a seizure, such patient should see the doctor for further evaluation.
All right. Doctor, there's something else. You didn't mention any medication. I don't know, maybe you did, maybe I missed it, but
okay.
Is there
so
any
the
particular...
reason why, yes, that was intentional.
Oh, okay.
I didn't want a situation where someone had a seizure somewhere and someone just goes to buy a medication to prescribe. That was why from the management plan, I deliberately titled it First Aid Measures. So they are to offer care. For any medication the person should be given by someone who is not a medical personnel should be the medication the patient has been on before. So that the doctors would handle the part of the medical management of the seizure.
Okay.
Because these drugs have their own side effects, and a particular medicine might be particular to a type of seizure, which non-medicals might not understand. So that was why I did not go into that at all.
All right, no problem. Okay. Another question, can the elderly also have seizures?
Yes. Seizures can occur in any age, infant, adult, elderly. Most commonly, the commonest cause of seizures in elderly people is when they've not eaten for a long time. We call it low blood sugar. I mean, an elderly person is at work since morning, they've not had a meal, suddenly the person is having a seizure. Low blood sugar can cause it. Elderly people, they are prone to having falls because their bones are not as strong as most people that are young. They fall, they hit their head. You said trauma to the head can cause a seizure. Elderly people are prone to having stroke. A stroke is an insult to the brain that can cause a seizure. Elderly people can have tumors in their head, cancers, growths in their head that can cause a seizure. So seizure can also happen in elderly people.
Okay. Okay, I can't see. No more questions. Okay. Okay, it's now 12:15. I think in the absence. Oh, does someone have a question?
Okay, what can we say of barbaric patients who abandon food? Can this cause a seizure? Please, can the person explain what they explicitly mean so that I know how to answer?
Oh, what? Adekemi Adesanya, please, can you unmute yourself so that you can ask the question because the doctor doesn't understand the question. What then can we say of barbaric patients who abandon food? Can this cause seizure? Madam Adekemi Adesanya. Okay.
But if the person means for patients who are not on food, that is taking food orally, where they have to maybe take food via drips and the rest. No, food via any route still provides good glucose
Hello?
control. That's the sugar level.
Hello.
Yeah,
What
we
I'm
can hear
trying
you,
to say is that
Okay, she's on.
trying to say is that what I'm like trying to say is that some patients or some people that are very fat and like kind of believe it is food that is causing it for them, so they don't want to eat, and some of them probably have maybe or whatever, and can that lead to seizure for them? Because sometimes
We can't hear you anymore, ma.
you have a sister. I have a sister who doesn't like to eat because she believes apartment is because of food and all of that. Can that cause seizure in the long run, or can it affect?
Sorry, I can barely hear you.
Seizure.
Madam Adekemi, please, can you repeat yourself? We can barely hear you.
So I'm trying to say that because maybe a psychiatric patient, I don't know what it's like.
Oh dear.
Something like that.
What is happening?
Madam Adesanya, we didn't hear what you said, ma. Madam Adesanya. Madam, please, can you repeat your question? Because we barely heard you. Okay, maybe it's her network or something. I don't know. Did you get anything she said, doctor?
No, I didn't.
Okay. But she's still on. Hello, Madam Adesanya.
Yeah, what I'm like trying to say is that
No, we can't hear you. You're not audible at all, ma. Maybe you should move closer to your device.
and then they tell you that they believe that the advantage sometimes is
I can barely hear her.
abandon food for a long time and all of that. So can that type of behavior lead to seizure?
Hello, ma. We can't hear you at all. Maybe you should put your device nearer your mouth, or if you're using an earpiece, you can remove it, ma. please go ahead.
I've said the question. I said,
Okay.
they're very fat people. We have them around us, and a lot of times, some of them don't want to eat. Either they are diabetic or not. And I'm saying that, can that kind of behavior, can it lead to seizure for them at any point in their life? That's the question. Thank you.
Okay. So, for people who do not eat regularly, that is for elderly people, not having a meal when you should puts you at a risk of having low blood sugar, which we call hypoglycemia. And that is a very common cause of seizure in elderly people. So not having adequate meals, which would in turn cause a low blood sugar, can cause an elderly person to be having seizures. But please note that for any elderly person having seizures, they should also be taken to a hospital to be evaluated to be sure that that is the only reason for the seizure and not something else. I hope I answered your question, ma'am.
I believe so. I think she's okay with the question, with the response. Okay, now it's 11 minutes to 12. I don't know if we have more questions or contribution. But like you said, it's not contagious. People can live normal lives. The medication is lifelong, right?
Yes.
Okay. And the causes are head injury, stroke, brain tumor. It's genetic, it could be genetic. Yes. Okay. All right. In the absence of any questions or contribution, I'll call, or if anybody is interested in thanking our facilitator for today, or maybe I'll just pick someone. Okay. Madam Yetunde Simpson, good morning, ma.
Good morning.
All right, good morning,
Good
ma.
morning.
Yes, ma'am.
Yeah. Good
Okay,
morning.
please.
Thank you.
All right.
Dr. Moritala, thank you so much for this wonderful presentation. It was really impactful and very interesting, very explicit. Thank you so much. And also thank service department from the post-service department of the PSO for PSO.
Yes, the
I
Office of the Head
really
of
thank you
Service,
for Office of the Head of Service. I really thank you for giving us this training. Thank you so much. God bless.
All right, thank you very much, ma'am. Thank you. Okay, so we've come to thank you, Doctor. Thank you once again for being on our call. And when we call on you again, you would gladly, I believe, come on board, right?
Definitely, ma'am. Thank
All
you
right.
so much.
Okay, thank you very much. Thank you. Okay, we've come to the end of today's session. Like we usually do, can we please unmute ourselves and put on our videos and say hello to one another? Thank you. Good morning, good morning, good morning.
Good morning. Good morning.
Good morning. Morning.
Mrs. Alishe, it's been a long time.
Good morning, good morning, good morning. Thank you everyone for joining. Okay.
Good morning, good morning, good morning.
Good morning, ma. Good morning.
Good morning, everyone in the house. Good morning, everyone. Well done.
Good morning, everyone.
Thank you, Mrs. Durodola.
Good morning, ma. Thank you.
Hello, good morning. Thank you, everyone, for service department. Mrs.
Good morning,
Dodd,
ma.
good morning to you all. We appreciate you, and God be coming to reward all of you. We are grateful.
Amen, ma. Yes.
And to all
Amen.
participants, a wonderful day to everyone. Stay blessed.
Yeah, looking forward to have more of this later.
Thank
Thank you
you.
so much.
Thank you.
Thank you, ma. Yes, ma. Okay. So we would have another session in the next 2 weeks by God's grace, and we would definitely come up with another interesting topic. So we look forward to seeing everyone then. So
Okay.
have a wonderful week.
And you too. Have
All
a
right,
great
ma'am.
day.
Thank you. God bless
Ahead.
you.
Amen, and you
Thank you
too.
so much. Thank you, everyone. Bye-bye.
Bye.